I do know Dr. Terrio is going to be unavailable today as she is traveling.
Okay, that's not a problem.
Looks like Steve is joining us. Stephen.
There's Steve Oglesby.
I think I've got 4 out of 5.
Hi, Russ.
Yep. Hey, how are you, Steve?
Good. How are you?
I'm good, thank you.
Yeah,
Thanks for
sorry I'm
joining.
late.
No problem. All right, and we'll see if Danny joins later. I think we'll go ahead and get started there.
Okay, yes, sir.
Well, welcome everybody. This is Russ Rinaldo, the Vice President of Finance at Owensboro Health, and welcome to the April meeting of the hospital TAC. We've got Aaron Vickers is our new liaison. Would you introduce yourself, Aaron?
Sorry about that. I turned everything off. I am Erin Vickers. I'm going to be your new Charlie. I did drop my email address in the chat, so if you need anything, please always feel free to reach out to me and I will help the best I can. And I look forward to working with everyone. Thank you.
So we've got Elaine Younts, Steve Oglesby, Teresa Fight, myself, the TAC members present. So we have a quorum. Looking to see if Danny has joined us. Doesn't look like it. So we'll go ahead and get started. The minutes from the last meeting were attached to the agenda. If anybody had a chance to review those, any questions? I have a motion to approve the minutes.
Motion.
Second?
Second.
Okay. The minutes are approved. Old business. So who do we have on the phone from DMS?
Hi, this is Leanna Trainer with DMS.
Steve Bechtel with DMS.
Hi, Steve.
Hey.
Hello,
Lee Geis. I'm sorry, Lee Geis with DMS.
Hi,
this
Lee.
is Wesley Penn with DMS.
Jennifer
Hello.
Dudinsky with DMS.
Okay. Want to make sure we have that in the minutes. All right. So I don't think this agenda is going to take us terribly long. I think the old business, the HRIP, I think this is to follow up I know all the hospitals are in the process of collecting their ACR data for submission by the end of this week, so that we can work on the print for next calendar year, the preprint. Anything else? The Q3, is that still on track for June-ish?
That's on track. We plan on processing those payments sometime around either the end of May or the first part of June.
Okay. Okay. And those would be the first ones that have the quality withhold, right? If I understand that right, I believe.
I believe so. I'll have to get back with you on that one.
That'll be the first one of this calendar year, right? With the January or March ones, right?
It's the January through March period. Yes.
Yeah, so I think that's right. Okay. Anything else that we need to know on that, Steve? Anything that you guys need from us?
No, we're working with KHA, with Carl and folks. Like you said earlier, trying to, if you can get us your ACR data as quickly as possible, because we would like to get the preprint submitted as quickly as possible, because the last time it took CMS a little longer than anticipated to grant the approval. So we don't want to wait till the last minute. We want to try to get that submitted as soon as we can get it submitted, so that there's not a kind of a break in service, so to speak.
Okay.
Right.
We'll do that. I would encourage everybody to get those, look at your own data and make sure that you've reviewed it, because it's not something that the KHA reviews for the hospitals that are on here. It's make sure you look at it from a reasonableness standpoint and make sure that it's been analyzed and it's right. Any other questions on that from the TAC members?
Did you see the MedPAC article, or did anyone else see that regarding just their desire, MedPAC's desire for more transparency on the Medicare or on the managed care direct payment programs such as the HRIP? Anybody else see that?
I will, you saying MedPAC or MacPAC?
MedPAC or MacPAC, I'm sorry.
Okay, I did see one similar, if you had two. The one I saw was from MacPac, and I'm still reviewing that. I just received that last week.
Okay. And my general question just today was, should that raise any concern, or do we think the way we've got our program structured that it still looks good for next year? Or is this
Well, I mean, I'd
really
hate
any
to,
takeaway?
you know, that's kind of a, it's really up to CMS really. And it's hard to say which way CMS may lean. But I don't foresee us having issues. But I don't want to say we won't, because anything can happen. But I have not reviewed the entire document yet to give you a definitive answer, so to speak, on the full review. But the first few pages I hasn't alarmed me just yet.
Okay.
But I reserve the right to take that back. If I do, I will share it with Carl and Herdy and KHA and Hal and them, and we'll be discussing it with you all through them or on the next TAC. You know, if I need to talk with y'all before the TAC, I kind of go through Carl and them to get to you guys.
Sure. Thanks, Steve.
Great. Anything else? Steve, I appreciate it. Thank you so
All right.
much.
If I may ask Carl, if Carl's on the phone, Carl, did you have that MacPac report? You want me to send it to you?
Yes, we have it. And yeah, I agree with your assessment of it. There's nothing in there at this point in time that would raise any concern from what we've seen. I think it may, maybe CMS does something else, with the overall programs, from that perspective, but there's nothing in there that we've seen, at least, that would raise any concern. So I would concur with your assessment thus far.
Thank you.
Yep.
Great. Thanks, guys.
Okay. Thank you. All right. The item we had was that serious mental illness task force recommendation from the last meeting. I don't know if there's any follow-up on that.
Russ, was that from a December meeting? Was that your
It
last
was.
meeting?
Yeah, it was. The December meeting was our last meeting, and it was the severe mental illness task force made a recommendation to the LRC, and it was for DMS to look at covering the cost of the long-acting antipsychotic medications.
Okay.
And there was concern about it if it's done in a hospital setting, right? The per diem or the payment wouldn't be adequate for that expensive drug.
Okay. Do you mind to follow that up with me via email after the meeting, and I will follow up with the staff that may have been sent out to in December?
Yep, I can absolutely do that. I'll send you the write-up that I had, no problem at all.
Thank you, sir.
All right, thank you. Who was that? I'm sorry.
It was me, Aaron. I'm sorry.
Oh, Aaron, okay, all right, gotcha. All right. Hold on your voice. All right, new business. Aaron, I think I sent this, the summary of what I was looking for here. So we talked about this, and it was probably before the pandemic, a little bit about the iPro, wanting to see if there was any kind of metric report on the number of cases that were taken to the iPro by each plan, or off of denials by each plan, and then what the iPro, whether they upheld the denial or overturned the denial, and then how many cases went to the ALJ. And I know there's a lot of cases pending with the ALJ, but what the results were with the ALJ. I think we continue to see, I keep getting cases where either sent to me or from my own shop where they don't, the iPro decisions really don't make sense. An example of one is where a patient got retro Medicaid for 3 months back, and the MCO denied it for lack of prior auth. And then it went to the iPro, and the iPro upheld the denial because we didn't have a prior auth that we couldn't have gotten because they didn't have Medicaid at the time of service. And so it kind of just jogged my memory on this topic and wanting to see, really what, if we have any metrics on whether or not, what kind of results we're seeing at the iPro level, because it costs money for everybody all the way around.
And I believe Leanna, a trainer, has joined us today to help answer some of those questions. Leanna, are you on?
Yep, ma'am.
Thank you.
Yes. Hi, everyone. I did get that information later last week, the request for those elements. I'm currently working on it and will be with my staff. Some of the requests we do have readily available, but there's some others that we don't, and we're talking about thousands of cases. So we're going to work together I'm going to work together with my team over the next week or two to work on getting all of the data elements that you had requested. It'll include the number of cases that were sent to iPro, the number of cases that were denied by DMS, whether or not it went to hearing, and what those decisions were. We did want to point out, though, one of the requests had specifically asked for if there was a disproportionate rate across the MCOs. And it's not going to be consistent because of the member counts. Of course, WellCare, Anthem have larger populations than the other MCOs. So we just in general, we get a lot more requests from those versus, say Passport by Molina or Humana. So what we can do in that regard is we can provide a percentage rate on what's approved versus denied, if that would be okay for what you're looking for. And then all of the other requests that you had wanted, we'll be able to get that. We just need some more time on our end.
That'd be great. I appreciate it, Leanna. Thank you so much.
Yeah, absolutely.
And Leanna, if you want, when all of that is finished, if you want to send it to me, I can always send it out to the TAC members. So you don't have to work on trying to get a list. I've got a group of them all set together.
Gotcha. Thank you. Will do.
Thank you.
Any questions from the TAC members or additional information on that?
None here.
Okay.
And I'll add, this is Leanna again. If there are any questions or any additional data elements that you would like, shoot me an email. I'll be happy to try to provide them or come up with some kind of compromise with the data. But just let me know if you need anything else with those.
Okay, thank you. The next item, the anesthesia changes. So there was a reg that had changes from last fall on some of the payable modifiers on the CRNAs and the supervised services. And we had a question from one of the hospitals about whether or not this was put into the system yet and effective, and the date that it was going to go. Is it going to go back to the effective date of the reg back in October or not?
And this is Lee Geis with Medicaid. And I have, good afternoon, everyone. I have looked up our change request. The effective date is the same as the regulation effective date, which is October the 20th, 2021. The production, excuse me, the production effective date was June the 1st, 2021. Is that right?
No,
No,
it can't be.
no, that's not right. Hold on a second.
This June, maybe 22.
Yeah, it says 2021, but I'm pretty sure that it is. I need to look to the next page. Hold on one second. Sorry about that. Right, it was April the 7th is the actual final status date. So the first production date was looks like April the 7th. But it did go all the way back.
Okay, so then the MCOs or know this so that they're gonna, if they have claims to reprocess. Correct?
I'm going to assume that the MCOs were notified, but I don't have that piece of knowledge.
Okay.
I'm not personally aware of that.
Okay,
That is our process, though,
okay.
when there's some policy change.
All right, we'll make sure that the hospital system that asked is aware of it, and if they have any concerns or things that come up, we'll direct them back.
Sure, just let us know if someone's having a problem with it.
Okay. I appreciate that. Thank you.
No problem. Thank you.
All right. Any questions there? All right. I don't have anything else on the agenda. Are there any other items from the TAC members that you want to talk about?
No, I don't.
No, I'm seeing no from Teresa, no from Elaine.
No.
Okay. All right. Our next meeting scheduled for June 28th. I appreciate everybody's time, and everybody have a good week.
Thank you, Russ.
Thanks, everybody.
Thank you.
Have a good afternoon, everyone.
Too. Thank you.